Hi, my name is Chris Morgan. I'm a physician at Summit Urgent Care. Today I'd like to take a little bit of time and talk to you about the influenza vaccine and how important it is to get it each and every year. The flu vaccine is designed to prevent a disease called influenza, which is caused by a virus. The symptoms of influenza, which a lot of people know, is pretty bad muscle aches, high fever, cough, shortness of breath. For a lot of people, GI upset as well, so nausea, vomiting, and diarrhea. And basically what I tell people is it makes them feel like they've been hit by a train. The flu vaccine has been shown to, in a large population, to completely prevent people from getting influenza. For another subset of population, it can significantly decrease the effects of the influenza disease. And it's also been shown to decrease the amount of hospitalizations as a result of influenza. The flu vaccine, depending on the year, can be up to 60% effective, and even the CDC estimates that in some years the flu vaccine can prevent up to 5 million cases of the flu. In addition to that, for those people that the flu vaccine doesn't completely prevent the flu, it can also decrease the symptoms and the length of time that you will have symptoms. So even if it doesn't keep you from getting the flu, it can make it where the flu is not as bad, which is also a very important thing. In addition to that, the other thing that the flu vaccine has been shown to do is it can decrease hospitalizations, both for the people who have other medical conditions that put them at risk, but also even for healthy people, because a certain small percentage of people every year who get influenza will be hospitalized, and even a smaller percentage of those will have something worse happen to them. Now, some people ask me, what about the preservatives and what about some of the other additives to the flu vaccine? And to that I say there's been extensive research about the flu vaccine and its current formulation, and almost all of it has been shown to be completely safe. Now, you can be allergic to a component of the flu vaccine, absolutely, so that's why you want to give it in a monitored healthcare environment. A lot of people ask if you need more than one shot, and there are a couple of populations like young children that will need more than one shot. The vast majority of people, it's a single one-time shot and that's it, and that's all they need for the year. So some people will ask if infants can receive flu shots. Absolutely, infants, and the CDC recommends that everybody over 6 months old gets a flu vaccine every year. Now the dosing will change, and sometimes we'll have to do more than one flu shot for those under 3 years old, but everybody over 6 months old, the CDC and I recommend get the flu shot every year. Some pregnant women will ask if they should get influenza shots, and absolutely I think they should, and most OBGYNs, in fact, strongly emphasize that their pregnant patients get the flu vaccine. And part of the reason is that there's some data that suggests that pregnant women who get influenza for some reason seem to do even worse than the general population. In addition to that, the injectable flu vaccine has been shown to be as safe as most other pregnancy acceptable vaccines and is not dangerous at all. In the worst case scenario, if you do get influenza, think of Summit Urgent Care. We take care of a lot of people every year some of whom did not get their flu shot, and they get influenza, and then we can take care of them. So come to Summit Urgent Care.